Hi, hello everyone. Good afternoon, good morning for some of you still. I'm Maggie. I work with AHEC on the Health Initiatives team. We also have the esteemed Reno Charette, who is our director on the Health Initiatives team. We're really grateful that you all could take the time to join us today for our stakeholders meeting. I am going to turn it over to Reno to go ahead and start. Um, with our welcome and opening prayer. And we have a little bit of a full agenda today. So when we want to honor your time and make sure we are done right at the top of the hour for everyone's benefit. So we will get right into it. So I will stop share and Reno. It is, I think, good for you to go.
Okay, thank you, Maggie.
Yeah.
Let's begin with the recognition of our higher power as humble people who wish to improve the lives of our relatives and protection of our homelands. We give thanks for the blessings of curiosity, intelligence, and perseverance that move us to many different paths in the search for living harmoniously with our family, our community, our tribe, state, nation, and the universe. We ask the Creator that you guide us every day for the right words and actions to treat all things with respect. We ask for fortitude and integrity to always speak the truth, to uphold Indigenous ways of knowing, and to acknowledge the role of spirituality in our work to make this world a much better place. Help us, Creator, to carry out our responsibility as leaders. Empower us with wisdom in our journey of nation building for sustainability in collaboration with our tribal colleges and universities and Indigenous communities. Empower us to recognize reciprocity as the foundation of living in harmony with all our relatives. By your blessings, we will find a way to lift up our communities by solving health disparities all across Indian country. Creator, hear our plea for help. Thank you for knowing what each of us needs to do in this work. Thank you.
Reno, thank you so much for starting off our meeting in that good way. I'll pull up our slides for share, and you can speak to the background of why we're here.
Okay, we've been trying for the last several years to bring together health stakeholders in the communities where we have a tribal college. Our effort is to see more research done by Indigenous people for Indigenous people and what they would like to see solutions for in their own communities. So we hold these meetings to help build the bridge between people in our tribal communities, institutions that have built a relationship with tribal communities and tribal colleges to come together to learn how to meet the needs of these communities in a better way. So hosting webinars like today is part of our mission. And in that, we are partners with you. And any topic that you would like to see us provide, we are always excited to receive that information and to find someone in our network who would be a good presenter to help our stakeholders be engaged. So we've got some more work to do. We're hoping to see more faculty from tribal colleges to participate. We're working with the chief academic officers to kind of nail down a designated contact person at each tribal college that wishes to engage in research. So there are other activities too. By participating, we are keeping track. And when there is an opening in our summer health institute, we want to fill a seat with a stakeholder. When we find out about health conferences that particularly address Indian issues, we have money to pay our tribal college students and faculty to attend those conferences. But when we have openings, we want to send a stakeholder. So those are issues that we would like to hear from you about. Feel free to send any of us, myself, Maggie, and Izzy. Her real name is Isabel. Send us your thoughts and how you would like to participate. So with that, I'll turn it back over to Maggie.
All right, thank you, Reno, for that intro and that reminder. Next up, we have Dr. Grace Karikari here with us. Yes. Today, and she will be speaking on grant funding opportunities. So in the past, we learned that this was a topic of interest for our stakeholders. So we are lucky to have Dr. Grace Karikari here with us today. She's from the University of North Dakota, and is part of their Indigenous faculty. So I will turn it over to her for her presentation.
Thank you so much, Maggie. Hi, everybody. Can you hear me okay? Fantastic. Can you also see the slide? Okay, wonderful. I'm looking at the corner because that's where I see you. So hi. We have a quick 20 minutes. I'm so excited to be here. This is actually 2.0 of identifying grant funding opportunities for research. We had the opportunity to talk about this last week, and it was recorded somewhere in this world. So I think Maggie Reno will share the link with that so that you can explore that at length. But thank you so much for being here. Because I have 20 minutes, I will share all the things I shared about in that presentation because I'm trusting you will go and look for that. But I love to brag about our program, the Indigenous Health PhD program at the University of North Dakota. If you need more information, please do check from our website. I'm faculty with the program, but I'm not indigenous of the United States. I come from Ghana, West Africa. I did a lot of talking about this the last time, but I love to share with people where I come from and where the accent is coming from, because you can spend the next 5 minutes just trying to figure it out. Is that Zimbabwe? No, that's Nigeria. No, this is Ghana, West Africa. Let us just leave it there. All right, I shared some pictures from my tribe. I'm from the Akan tribe of Ghana. This will actually be the lady down there, but we have very similar cultures, a lot of food that we share. And if you need to know more about Ghana, reach out to me, or you can actually Google. Google is one of my best friends, you know. So always Google and then find someone to verify if that information is correct, though. But I'm from Ghana. I love Ghana. I love to always also share my parents. They brought me to this world. I'm also a mother of 3. So if I'm not working, I'm very, 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 very busy. I do have lots of certifications, a lot of education in the United States. Though I'm from Ghana, my master's, PhD, and all other certifications are from the United States. But one of the things that probably is the reason why I get to talk to you today is that I teach grant writing and management at the University of North Dakota. So this program or this class is actually open to both PhD and master students. And I teach it in various forms. And this is one of the ways we also do webinars and all that. So if you need more information about me, if you want me to talk more about grant writing, please check the university's website. You always find our email addresses there, or you can reach out to Maggie or Reno to also find us. We work very closely together. So identifying grant funding opportunities for research or for community work or for anything that you need grant for, where do you start from? I talked about this the last time, that we are all in different stages of our lives, and when it comes to our career, I would actually love to hear which level are you in. So type in the chat, beginner, advanced, middle, self-assessment. Okay, when it comes to grant writing, where would you place yourself? Would you say you're a beginner? Would you say you're an expert? Would you say never written a grant before? Where, just give yourself 2 seconds of assessment and put it in the chat. But I was thinking that we could be on different levels. We could start from the idea generation phase, where you have an awesome idea and you are looking for money to fund that idea. Sometimes too, we have already good with our idea. We're already good with the funding sources. We know where we want to go for the money. We just need to work around the proposal development. We are just not sure how to even put it together. Other times too, you are just there minding your own business. Somebody has the idea, has the money, has written the proposal, and is just dragging you in, whether based on your expertise or your affiliation. We find ourselves in different stages, but we are all not always on the same page. But typically, this would be the grant cycle: idea generation, then finding the money, writing the proposal, submitting the proposal. Hopefully, you get funded, and then you get to manage the grants, and the cycle goes on and on and on from there. So quickly looking at the chat, I see mid-level. I have written one grant before. Okay. Made 3 grants written, awarded, managing. Wow. I think I have to stop this presentation and you should take over. You know, we all have awesome experiences and we should definitely share with us. So then back into the chat, quickly put into the chat what other terms we should know about, especially those who have written grants before. Sometimes we hear of different things when it comes to the grant announcement, okay? You may see or hear people use FOAs, funding opportunity announcements. One very common one will be the RFAs, request for applications. And I really enjoy the PAs, program announcement. Usually foundations will use that. And then the NOFO, notice of funding opportunities. Which ones are you familiar with? Are there ones that I haven't put in? Oh, Reno, you've been writing grants for over 30 years. That's fantastic. So put in the chat if I missed any term that we should all be aware of, or when you are likely going to see out there. So this chat, I used to brag a lot about it. I was very confident about how grants are being dispersed in the United States over 4 years of teaching this class. But this year, one of the first times I cannot confidently say where the funding will be coming from. Typically, the federal budget looks something like this, where they have money allotted for defense, they have money allotted for not defense discretionary funds, they have their net interest, they have the mandatory, and then grants and fellowships and monies that we can use to support our community and research will usually come from the 14% out here. That is still a lot of money considering we are looking at billions of dollars, okay, 6,000 billions of dollars. So I love to share this to show people that you shouldn't be afraid that there isn't money, you are tensed about where to find the money. That should be out of question because the money is there. The challenge or what you need to be thinking about is where to find the money. And I think that is what most of us want to figure out, especially the beginners. There are several places you can find money, okay? In the past, I could boldly also say NIH, CDC, these are changing, and that's okay. That's okay. They are not the only places where you can find money for your research or your community project. So, which agencies are you familiar with? Which ones have you been using so far? Okay, which ones have you been using so far? Put in the chat. The chat is for all of us. I won't be going back and forth in the chat, but for all of us to just engage. We have government funding, which used to be NIH, National Science Foundation, Center for Disease Control. We have state level fund, we have county level fund, we have city level funding, different things. Like I heard this week, there are some opportunities that the federal government used to fund and it's no longer funding, but state, the state is still funding those opportunities, right? So sometimes they align, sometimes they don't align. We also have private foundations and nonprofits. Sometimes they give big money, sometimes small money, but our aims and our goals and our objectives sometimes aligns better with private foundations than with the government, right? We have institutional opportunities, we have international opportunities, depending on the project you are looking at. So just put in the chat which ones you've been using the most. And I may miss some, okay? So if I miss something, do put in the chat. Somebody is probably taking notes and will really benefit from the ideas you have. When we take government or multilateral organization, we have European Research Council, we have the Horizon Europe Council, we have the National Institute of Health, which used to fund internally and externally. We had the UK Research and Innovation Grants, which supports multiple funding councils. We had the Australian version. We have several multi-country and even intercontinental opportunities. That may not be what you are looking for, but if you are looking to look beyond the United States and projects, let's say you are very interested in plant medicine, which is something that I research on, one area that I work on, plant medicine and how it is used in Ghana, so that you can learn how we can incorporate that in Indigenous USA. Maybe you want to look for international fundings that will support your travel to Ghana and your ability to research in Ghana and bring that idea into the United States. Sometimes there are funds like that looks beyond your immediate country. There are other options here that Mr. Google helped me with. I think there are many more out there depending on what you are looking at. We also have the private foundation, and I'd love to share that most of the time big organizations, big institutions do have money they put aside to pump into the communities, and sometimes they're able to get these back through taxes. So they love to do that. They love to help their communities with the profits or the revenues they are generating. Sometimes even hospitals like the All True Hospital may have some funds. Maybe that funds will go towards paying bills for those who are unable to pay, but sometimes it also goes towards research, understanding a specific situation within the community that can help with their work efficiency or the health and well-being of the people in the community. So we shouldn't always think so far and so broad, like it has to be NIH, it has to be CDC, it has to be Bill and Melinda Gates Foundation. They are very well known how they fund a minority population, little projects within rural communities. They also fund a lot of international projects. So they are very well known. But apart from them, there are several other opportunities out there. Look up Coca-Cola. I do know of Chick-fil-A. Chick-fil-A really invests in women entrepreneurs. For that, I know is that every year they release some funds that go towards women. I think so. And then there are many more organizations around. We also talked about the opportunity that sometimes may be specific to a region. So when you are doing the Google search, I did that with Maggie the last time. You take your idea, you Google it, you can put in the specific idea and the specific community you are hoping to get the money for. And many opportunities will generate. But how do you sort out what kind of opportunity is relevant to you and which ones are not relevant to you? That is where we are going to work smart. Hard work is very important. No matter what you do, there will be some relevance of hard work there. But if there is a way to make it easier, don't make it harder on yourself. And one way to do that is to find a process for your search. Okay. So always begin your search from an informed perspective. What exactly do you want? What exactly are you trying to achieve in this situation? So begin the search with a guided structure or criteria, and I'll share one with you in a moment. Search for grants that are in sync with your aims and objectives. You don't want to go for money that doesn't support the specific project you want to do. Okay, now we are in a situation where funds are being pulled if some terms are used. But what if those terms or those specific population are the people you'll be working with? It means that that funding source is not for you. You have to find other funding opportunities that will align with your objectives and the aims of your specific project. So talking about a rubric, get a rubric that you can use to categorize your opportunities. So I'm sharing one in a table which just takes 3 aspects. This opportunity is absolutely acceptable. That means it is in line with what you want to do, it's in line with your objective, and you should definitely look further into it. Absolutely unacceptable. It is not in line with what you want to do, whether being the population is looking at, whether being the funding amount, you need more than that or less than that, or you can't even account for how much they are giving you, or it is acceptable. Well, that is not exactly what you want, but you could probably do with this, So you put it in that category. So a table like this, very, very simple. You take one opportunity. When right now I Google, projects for minority children in rural areas, there could probably be hundreds, if not thousands, of funding sources that will pull up, but not all of them will be relevant, right? So I may give them a quick scan and quickly take away the ones that I don't think are important. Then I may save the link to the rest that I need to look further into. That is where this table will come in place. So I take foundation A. Is this appropriate for what I want to do? Okay, this looks like something I should even look further into. I will save it there. Or maybe it's not, right? It's inappropriate. I'm looking at minority children, but they want you to include maybe ages 18 to 24. That is not what you want. Or you want to specifically look at indigenous populations, and this grant is not for indigenous populations. It is not. You shouldn't force yourself into a grant that is not for you. So some of the things you can look at when it comes to the funding search, you can look at things like eligibility. Are you eligible for this opportunity? What makes you eligible? What doesn't make you eligible? What are they looking for when it comes to eligibility? Conditions. What are the conditions surrounding this opportunity? What are they expecting you to do in return for the money you are receiving? Matching requirements. Sometimes some of the grants will require that you have some kind of matching opportunity. So we give you 50,000, match that with 50,000. Or if your organization is able to produce 100,000 in kind means that it could be not paying your staff from the grant. So you as an organization will take care of all the other things, and the money they are giving you may go directly into the project. Sometimes to allowable cost, which will be you are not allowed to use the money for conferences, you are not allowed to buy food from the money, you are not allowed to do this, but you're allowed to do this. Some of the grant opportunities will specifically say it's not for traveling. Maybe you also need this opportunity so that you'll be able to travel to communities. If you don't pay attention to this, you will secure the funds and you will not be able to use it, because exactly if you use your funds, you will not be reimbursed, because that is not an allowable cost. Some grants opportunity will allow you to rent a facility for programs. Some grants opportunities will not. So what is allowed in this opportunity and what is not allowed? And is that aligning with what you need to do? And then the program area, you want to work in your community. Is that allowed in the grant? Is the grant specific in folks in North Dakota area? Or the grant is specific for people in Arizona area? Or is it open to all? Something you should think about. And then the funding amount. I think we sometimes underestimate how important this is. And we look at the money, oh, 500,000. I think we can put things in the budget to make up for it. Do you really need that amount of money? And can you justify the need for the money? And also, when the grant is being reviewed, the proposal is being reviewed, have you handled that kind of money before? Remember, there will be a review process. You don't know how many people are applying for that opportunity. The fact that you can spend it doesn't mean they should give you the money. Okay, if the last grant, the last opportunity you had, you've handled, let's say, $50,000, and now you're applying for $500,000, how do you justify that gap? Is your facility able to manage that money? Maybe they can. Maybe you can write that you have a grants manager who will specifically be dedicated to this and everything will be fine. But sometimes that's something to look at. People go for more than they have the capacity to handle, and for that reason, the application is not successful. And sometimes we just go also for the little we can see, and that becomes stressful because it may just be a $10,000 grant, but the reports they will be requiring from you, the requirements and this and that may not be worth your community time. or your professional time. So always take your time, look at what you need, look at the amount being offered, and see if it's in line with what you really, really need. So let's say you already have an opportunity that you are going for. You've already seen the funding application. So what next? Let's keep in mind that there is no such thing as free money. There's no free money anywhere. It's either a taxpayer money, it's either a family donating in terms of the foundation, it's either a business trying to invest in the community. Whatever it is, there is no such thing as free money. Think of the money with some kind of grace and importance, and I think that will help you with the proposal writing. You don't write any proposal that you know is not relevant. That money is important. So as much as you're going for it, put your heart and soul into it. Money is not free. And then before the full proposal, what are some of the things you can think about? Think like the reviewer, write for the reviewer. You are going for the money from an organization, from an agency. What are they requiring from you? Use their terms. Use their required information. Use the formatting, whatever they said they want. Don't write it in a way that you want to write it and how you want to say it, because that's what you prefer. Think like the reviewer. If you were to review the proposal, would you give the money to somebody who didn't follow the instructions? Probably not. It would just be the first sign to say, if they can't follow simple instructions in their writing, I don't think they'll be able to spend this money wisely. You are just going to take them out based on that. And then think of this. Will your research have the greatest effect or make the greatest difference? There could be many people competing for that money or not. Maybe this money is just allotted for you and your community. But think of the project. How can you make the project effective? And how can you make the greatest difference with whatever opportunity you are writing about? And does your proposed research meet the objectives and requirements in the RFA? You just talked about that. Think of the mission you have and the mission they have. Are you aligning? What about the eligibility, conditions, deadline, amount, program area, all the things I briefly talked about? And then do you have the expertise to accomplish the research? Can you collaborate? There are some opportunities, they have specific requirements. They need a statistician on board. They need a counselor on board. I remember a project we were working on. They believe that there could potentially be trauma involved and people are going to remember things that are going to be traumatic to them. So on the team, they require that we have a therapist on team or a counselor, just in case that service is needed, it can be provided. So if you don't have that kind of expertise, can you collaborate? You write that in your proposal. And then you can always contact the grant coordinators, the managers, the officers. Usually when you receive the announcement, there is always somebody's name. For more information, contact person A, and then there will be an email address. Always contact that person if you have questions, if you want to clarify anything, something is not clear, or you just want to check in and see if your project aligns with the money they are giving you. You are not really clear on the program area, or maybe the duration of the grant, or how quick the money will be reimbursed. Some of the grants, they give the money, you do the work. Other grants, you pre-finance and then you come for reimbursement. If you don't have the money or the resources to pre-finance, you need to ask and know ahead of time before spending all this time into writing that proposal. Remember, we are working smart. We will not put in the work before we get the rewards we need for it. And then letter of intent or concept paper can always be good to confirm the appropriateness. So if you want to just put everything into an idea form, 1 page, and send it for the program officer to review. Hey, this is what we are planning to do. We are interested in this opportunity you announced. Do you think this project aligns with what you want? And then the program managers are trained to be able to provide you with the necessary information. Maybe not necessarily saying, yes, you will get it, or no, you will not, but they will be able to guide you if it aligns or not. So quickly, I did share this at length in the other one, so I will not keep you here. Every agency organization do have their review criteria. This is from the NIH, it's on their website. So my recommendation was whatever opportunity you are looking for, look for their criteria and write your proposal to meet that. Use their titles, use their formatting, use their language, write it for the reviewers. And then there is always that question, what is the secret to an award-winning proposal? Just read the announcement. Just read the RFA. Read the NOFO. Read the FOA, whatever they call it. Read it as often as they want. It's like your guiding Bible or your guiding book or your recipe to success, if I should say. Whatever they want from you, most of the time it is listed there. And when it's not clear, always ask questions. So this is just a summary to get you excited about grant writing, to get you going about getting started with your funding search for your research for your project. But I know that there is more to this, and subsequently we can have more conversations about grants. We can look at the management aspect. We can also look and maybe practice some searching. If we want to do that online, how do you search? How do you sort out information? Many, many more can be done. But we thank you so much for joining this overview, quick overview, and I hope that you get the link to watch the full video.
Yeah.
Thank you.
Dr. Karikari, thank you again. I had the privilege of seeing her first presentation, and both have been just very informative. So we do want to take this time now to open it up for any type of questions or comments you might have. Feel free to just unmute, informal. You can also pop things into the chat if that feels like a more comfortable way to ask questions. So I open the floor to you all. All right, and maybe we don't have questions at this time. So I do invite you, if something does come up as you go through the rest of your day, you are welcome to send me an email and I will get in contact with Dr. Karikari. And I think also you had some of your contact information posted, so additionally you could probably contact her directly. And certainly we have a little bit more to our stakeholder meeting today, so if something comes up before we end, let us know. So we will go ahead and keep moving along then. So the next thing I wanted to share with you all, and let me get my screen back up, is about our new, let's see, we are working on 3 credit courses. And let me get it here. So we will have this be our focus at our next stakeholder meeting. So definitely more to come on this, but we are in the very beginning stages of development for 3 credit courses. This is something that our team has been working on kind of in fits and starts for a little while now, and we're really excited that we have gained traction and we are moving full steam ahead on this. Dr. Tyler Parisian with Turtle Mountain College is the one who is helping to bring all of our bits of information together and help us work it into cohesive 3 credit courses. So the idea of this is that we are working to create a full class. We got one more joining us. A full 3 credit class that we can offer to tribal college and university faculty. And so the idea of this is that we don't want to replace anything that already exists, but we want to provide a resource if a faculty member needs a course, if a faculty member needs parts of a course. We want to provide the tools, the resources to reduce any sort of extra burdens that may befall some of our tribal college and university faculty. So that's the idea behind creating these courses. So it'll include syllabus, it'll include quizzes and lectures. And the idea is that it can be included in your class in full or in part. So the more important thing that you're probably interested in is what are the courses we're developing. So we have Indigenous Research Methods, We have grant writing, so you will definitely see some of the lecture that we just saw woven into that. And then we have Intro to AI History and Health Policy. Certainly, we are hoping we have a lot of content that we've created over the years, our team, and we're hoping that there might be room for more creation of courses along the way. But for now, this is where we're starting, and we're really excited to talk to you more about that at our next stakeholder meeting. Separately, what we will need from you all as our stakeholders is to review some of the content as we build it. And this is a really important component of this because we want to make sure what we're building and how we're building it is going to be most impactful. So if this sounds like something you are interested in doing, and we'll probably send out some kind of surveys in the near future, but if you would like to be a part of helping to review these courses as we put them together, reach out to me. I'm Maggie again. I know my name isn't listed down here. Or anyone on our team really, and let us know that that's something you are interested in doing. Any questions right now about those 3 credit courses? Okay. All right. So moving right along, we have a number of upcoming events in our programs, and I am going to, whoops. Oh gosh, I hit my wrong button here. Let me get back. All right. Here we go. So we have a number of things coming up that we're excited to share out, and we would love for your attendance. We did just have a Health Research 101 webinar with Dr. Karikari. That was where she did her full presentation for us on grants. We do have 2 more coming up, one in March and one in April. So we would love for you to put those on your schedule. We have March 21st and then April 22nd. And those are going to be on qualitative versus mixed research, introduction to quantitative versus qualitative versus mixed research methods. And that's our March webinar. And then we have introduction to IRBs and alliance agreements. And that is our April webinar. So those are both, you can see over here, Dr. Shonda Shorter. She is another UND faculty member with the Indigenous Health Department. So we're really looking forward to those. They will be great presentations, very informative presentations. Next, we have our graduate certificate program for our TCU faculty. So we are concluded enrolling for this semester as we're about halfway through it, but we're looking for the fall. So if there is anyone who you know who might be interested in this opportunity, this is a graduate certificate program with the University of North Dakota. This is part of our NARCH BIRCH grant. And we are very excited to get people enrolled in this. Something to note is it is a graduate certificate program, but if there is interest to move through that program and into a PhD, yes. Yes, thank you, Reno, for pointing that out. We do share all of our webinars on our Health Initiatives YouTube page. So if you missed something or you want to see it again or you want to pull it and use it somewhere, totally free and accessible to you. Anyway, graduate certificate program for our TCU faculty. If this is something that you know someone who might be interested in this, we are looking to register people. We provide full funding for all of this program. It is online program, so let us know. We also have our 2025 Health Sciences Summer Institute coming up. This is our second summer doing it. We're holding it June 9th through July 4th. It's a 4-week program. The first week is virtual. We have our middle 2 weeks, June 16th through the 27th, in person on the UND campus. And then we conclude with a final week ending on July 4th. So we are currently registering students for this program. We're really excited. It was a great program last year. So again, if there's anyone that is looking to be involved in that, send them our way. We would love to get in touch with them. We also have an iHeart AIA and Healthcare Workforce Development Summit coming up in just a month, March 19th through 20th, 2025. Again, if this is something you're interested in attending, it's completely online. Reach out to us. This is going to be, Izzy Burke is going to be your best contact for this, and we can get you registered for that. And then finally, we hope you will attend our next stakeholder meeting. We try to hold these about quarterly. So our next one is going to be in May 2025. We don't have a set date yet, but certainly as soon as we know, we will let you know, so that you all can get it on your calendars and join us. And as mentioned, we will dive even further into our 3 credit courses at that time. Okay, and here are our webinars. Just again, the 2 coming up in March and April. Okay, so before we get in, we do have an exit survey. We would love for you to take that. It's just a simple code. I can also pull up the actual link and I will drop that in the chat just for ease, in case that's a little easier. But I do want to open it up. We are wrapping up a little earlier, so I would love to open this up for any questions, any comments that you may have at this time. Okay.
I have a question.
Yeah, go ahead.
The summer student institute, is that fully funded for them to go to North Dakota?
Yes, yep. It is a fully funded opportunity. We pay, AHEC, our grant pays for room, board, food, travel expenses, and then they get to take classes from the UND faculty, such as Dr. Karikari, but fully funded, yes.
Okay, because we're in California, so I just wanted to make sure.
Yeah, yep, absolutely.
Okay, thank you.
Of course. Okay, any other questions? All right. Reno, anything else you wanted to share out?
I just posted some of the dates of upcoming events that we are involved with, and that the stakeholders might be interested in participating. So if you would like to go to a conference, it needs to be related to Indigenous health. And we do favor regional conferences because they're less expensive for you to go and less time that you're away from your home, job, family, whatever. So we would really like to hear from all of you on what is going to help you be a better researcher for your community. So that's it. That's my soapbox.
All right, thank you, Reno. Okay, well, if there are no more questions, that is the end of our meeting for today. So we do appreciate you taking the time to be here with us today. I know we all have really busy schedules, so we do appreciate you all making the time to be here with us. Dr. Karikari, we appreciate, once again, fantastic presentation. We are grateful for your sharing that information with us, and certainly we will tap you again for even more presentations. You are a wealth of knowledge, so we appreciate it. And to anyone else, any of those resources or opportunities that were mentioned, if you're looking for more information about those, definitely reach out, and we will connect again in the spring. So thank you again, and have a good rest of your day.